Hello, I'm Changi Lee, the MAEM student at PDRC. Today, I'm going to talk about comparison of different live vaccine programs against the DMV1639 IBB challenge in broiler. Infectious bronchitis virus is a single-stranded enveloped RNA virus belonging to gamma coronavirus, which is only restricted to avian species, primarily to chickens. It is a highly infectious pathogen of commercial poultry, causing respiratory distress. It can replicate in reproductive tract and cause the drops in egg production and decrease egg quality in laying period. Some strains are nephropathogenic and causing high mortality, flushing, and retarded growth. It is found worldwide, and there are many serotypes or genotypes identified. Genetic diversity as of large-size RNA virus is created by rapid replication, large population size, and a high mutation rate with a limited proofreading capacity. Diverse genotype can be identified by amino acid sequencing of the S1 unit of the spike gene. IBB is firstly identified and isolated in the US and named for the state originated from. Massachusetts type IBB in 1930, then Connecticut type in 1950. 1970, Arkansas type virus appeared. Since 1990s, number of different IB variants have been isolated from California, Pennsylvania, Delaware, and Georgia region. These are serologically distinct, and each type of virus shows poor cross-protection. DMV1639 is regarded as the most recent IBB variant, started in the Pennsylvania but was isolated and named on the Delmarva Peninsula. As a nephropathogenic IB, the clinical presentation was reported to be classic sick chickens that huddled, lethargic, dropped feed and water intake with a severe flushing. However, recent outbreaks showed more respiratory signs and processing condemnation rather than kidney region. Also, there are cases showing false layer syndrome in laying hens reported in the US and Canada. As there is no homologous live vaccine commercially available, other type of IB vaccine was used for cross protection, for instance MES type or Georgia OA type. Besides strong biosecurity, the live attenuated vaccine used successfully for the protection of infection and the reduction of clinical signs. It showed the best protection against homologous strain challenges. Also, the combination of two different types of IBB vaccine provide a broad cross-protection and reduce the secondary infection. To success the vaccine strategy, we needed to select the right type of vaccine and design the efficient vaccine program. The quality of application is critical, and active surveillance for the field challenge needed to be followed. The purpose of this study is evaluating the vaccine efficacy and the level of protection against the DMV1639 challenge. Single or combination of 3 different vaccines used in this study. 2 commercial vaccines as mild type, MES type, and Georgia OA type, and special permit DE1639 that is used in certain locations on the shore over the last several years. Design of this study mimics the field condition as we used the commercial broiler with a positive maternal antibody, vaccine applied with a spray cabinet, and chickens were placed in colony house with fresh litter and open access to feed and water. 10 chicks for each group was vaccinated by spray with a full dose of vaccine after hatch. Single or combination of live vaccine were given to each group as you see in this table. At day 7, all chicks in each group were swabbed in choanal cleft. For group 1, we took swab sample at 14 and 28 days additionally. At 28 days, 15 birds from each group moved to isolator. Among them, 10 birds were challenged with the DMV1639 and 5 birds kept as control. 5 days post-challenge, clinical signs were scored, and 7 days post-challenge, intrachoanal swab was taken to detect the virus. To evaluate the efficacy of the vaccine take and the level of protection from challenge, swab samples were analyzed by the real-time PCR. Mean CT values and the percent of positive were measured. Also, clinical signs post-challenge was scored as below scoring system. At 7-day post-vaccination, this special permit DE1639 vaccine alone showed that only 60% birds were positive and viral load in those positive was only 33 CT values. This is lower than what we want to see in typical vaccination. When combining with other vaccine, either MAS or Georgia 08, DMB text dropped to 30% and 10% respectively with similar CT values. Maybe there is some interference from other vaccines that do infect and replicate better, as evidenced by the nearly 100% positive take and much higher viral load as 25 to 26 mean CT values in each group. In comparison, Georgia 08 vaccine alone showed a very high level of viral load as mean CT value of the 24 and 100% positive vaccine take. However, when it combined with the MAS vaccine take was only 60% positive and viral load was a bit lower than Georgia 08, and many of birds showed uneven and lower viral load. So we do see some of the vaccine interference in combination of vaccine similar to previous slide. Because we found the lower vaccine take and viral replication in DE1639 vaccine, we took additional intravenous swab for group 1. At 14 days, group 1 showed higher percent of positive birds as 85% and mean CT value of 26. This indicates that there is delayed peak replication for this vaccine, which is not typical of the live vaccine, as we are expecting to see peak replication around 7 days post-vaccination. Also, at 28 days, still 30% of the birds was positive and 28 CT values. This could indicate that the possibility of the vaccine rolling is happening in this scenario. We challenged the birds at 28 days when we transfer birds into isolator. The results show that regardless of which type of vaccine we used, clinical signs were significantly reduced compared to non-vaccinated challenged group, except the MAS plus Georgia 08 group. They are not significantly reduced clinical signs. It is interesting to note that Georgia 08 alone or combination with MAS experienced more harsh vaccine reaction before moving to isolator. We may assume that these clinical signs post-challenge may influenced by previous vaccine reaction in this group. Viral load after challenge we measured by DMV1639 type specific PCR. The results show that all group has significantly lower viral load than non-vaccinated challenge group as 24 means CT value versus 32. However, majority of birds were positive for DMV virus after challenge. This means all group has some protection as we see the reduction of viral load in similar level, but it was not complete full protection. Only the DE1639 plus MAS group showed lower positive than other groups. This challenge test done with randomly selected 10 birds out of hundreds we vaccinated. Because other group doesn't have that kind of reduction, it may not because of true protection, but the sampling variation. In conclusions, special permit DE1639 vaccine did not replicate efficiently compared to other commercial vaccines. Also, we found that this group has delayed peak replication and vaccine rolling. Potential vaccine rolling can lead to partial protection or vaccine failure. In combination with other commercial vaccine, the DE1639 vaccine reduced its uptake due to competition of the viral replication. Also, we note that all groups with the Georgia 08 had worse vaccine reaction than MAS or DE1639. Clinical signs in all vaccinated group were significantly lower than unvaccinated challenge group. This means any vaccine can reduce the clinical sign, so the clinical sign may not be the best measurement of the protection. Viral load in all vaccinated group was significantly lower than unvaccinated challenge group. However, majority of the birds was still positive, so this represents that protection per DMV1639 was only partial. Thanks for listening. I would like to acknowledge the people who helped me to complete this project. Debbie Hilt, Dr. Gergen, Nichols, and French, and many of the visiting students to PDRC. This is a picture of my MAEM classmates, me, Linnea, and Katie. I'm happy to take any question on this presentation.